There are currently 4 confirmed outbreaks of typhoid fever in South Africa. Cases have steadily been increasing since 2020. The National Institute of Communicable Diseases warns that the outbreak may be much worse, as health professionals don't generally test for it. Well, typhoid patients often present with flu-like symptoms. Dr. Juno heads the Centre for Enteric Disease at the NICD. Dr. Thomas, thank you so much for joining us. What are some of the symptoms of typhoid? Doctor, you're on mute. Just press the mute button. Off. Let's try
Apologies.
again. All right, let's start again. Dr. Thomas, what are some of the symptoms of typhoid? I mean, for me, typhoid is such a sort of decades-old disease that I've almost forgotten about it.
Yes, in fact, most people have forgotten about it, including healthcare workers who don't see very many cases anymore. But typhoid fever has been around in South Africa for many hundreds of years, at least, since we've recorded cases of typhoid. And we continue to see typhoid cases across the country every year. So it's nothing new. In terms of how typhoid presents, the term typhoid fever, in fact, gives you a very good clue that the major characteristic of infection is a fever, which is usually very high and lasts for many days, if not weeks. The rest of the symptoms of typhoid fever are quite non-specific, though. They include being very fatigued and tired, and having headache and nausea. Some people get abdominal pain, and quite a few people will get diarrhea, but as many people may also get constipation. So it doesn't present like a typical gastroenteritis or tummy bug, and can mimic many other infectious diseases, many other bacterial infections or viral infections. So that's part of the problem, is that unless healthcare workers are aware of how typhoid fever presents, and then they do the correct investigation, which is called a blood culture, these cases may be missed. So we are sure that many cases of typhoid fever are missed around the country, particularly if patients have milder disease and don't end up going to hospital, where it's more likely that they will do the specialized test, or perhaps if they're in areas of the country where ready access to that kind of specialized testing does not exist.
Dr. Thomas, was typhoid so prevalent because of poor sanitation? How do you get typhoid?
So yes, typhoid is a disease that's predominantly linked to poverty. And that's because it is spread by what we called the fecal-oral route, where feces that are carrying the bacteria contaminate food or water, and then susceptible people drink or eat this food or water that is contaminated. So it used to be very prevalent in all parts of the world. Even until the early 1900s, typhoid was still prevalent in many parts of Western Europe, and even in some parts of the UK, for example. But with the advances in safe water supply and in formal sanitation, the cases in those countries virtually disappeared. So the risk factors for typhoid fever are, for communities that have limited or no access to safe treated water, as well as, formal sanitation. And other measures that are important for controlling typhoid are linked to being able to identify cases early and treat them, so that patients don't continue to shed bacteria in their feces, because unfortunately many patients, when they have recovered from typhoid, continue to shed the bacteria in their feces for a time, and some patients may even continue to shed bacteria lifelong. So this means that these people become reservoirs of infection and can lead to ongoing transmission within the communities.
Dr. Thomas, quick last question, not directly linked to typhoid, but there is a very bad so-called tummy bug going around here in Cape Town, and I was wondering if we're seeing these old sort of bugs circulating again because we're not masking up as much as we have been, and we're being a little bit more relaxed in terms of sanitizing and hand washing, etc., as we're out of the sort of fourth wave.
Okay, so I mean, firstly, as I've mentioned, the current reported increase in tummy bugs and acute gastroenteritis across parts of the country is not at all linked to the typhoid fever cases that we've seen. But just to mention that every year in summer, we do see an increase in acute gastroenteritis or tummy bugs across the country. And it's linked to a seasonal increase. There are certain organisms, like other types of salmonella called the non-typhoidal salmonella, as well as Shigella and norovirus, that typically do increase in summer months. So we do see a lot more gastro on an annual basis during summer months. However, I think hand hygiene, we know, plays a pivotal role in preventing a lot of these gastrointestinal infections. So it is plausible that, with perhaps relaxed hand hygiene and sanitation, that, it has promoted a slight increase in the number of cases as well.